Hi, my name is Donna Function. I'm going to be doing my skill check for IV primary tubing. Okay, so the first thing I'm going to do is I'm going to get my physician's order and my MAR, and I'm going to check it for consistency for both of them. I got my patient, A.B. Doman, date of birth. They're both 10/31/35. They're both room number 305. I check for allergies. There's no known allergies. I see here that patient's getting lactated ringers at 125 milliliters per hour. So now that they're both checked and they're both right, I'm going to go to my med room and gather my supplies. So I enter my med room. I'm going to grab my IV solution, a set of primary tubing. I'm also going to gather 2 alcohol swab and a syringe of saline fluid. And I'm going to look at my IV solution and check the expiration date. I'm going to check the amount of liquid in there. I'm going to just check the bag for any other issues it seems to have. Make sure that it's the right fluid that I'm supposed to have. And it says lactated ringer on it. Then I will check my tubing, check the expiration date, make sure on the package that it's also the right size needed. Let me gather my supplies. Before I do that, in the med room, I am gonna figure out the drip factor for my solution. I'm gonna do drip factor per minute, so I'm gonna do 15 drips per minute over 1 milliliters. I'm going to times it by the 125 milliliters per hour, and then I'm going to times that by 1 hour over 60 minutes. When I cross multiply and figure that out, I get 31 drops per minute. So now I can go into the patient's room. Gonna gather my orders, grab all my supplies. I go to room 308. I knock on the door, hand hygiene, introduce myself. Hi, I'm Donna. I'm going to be your nurse. Can I have your name, date of birth? I'm going to pull the curtain. I'm also going to ask the patient if he has any allergies. Okay. Then I am going to let the patient know that I'm here to change their IV fluid. So I'm going to check their IV site for redness, swelling, any drainage, any discharge for temperature. Okay. And then I would open my bag of lactated ringer. Here I would also check the expiration date. I would check the medication, lactated ringer. I would check how much is in the bag. Okay. I would tell the patient that it's to replenish some of the electrolytes they've lost during surgery. I would also squeeze the bag for any leakage. Check the fluid, make sure there's no different colors, clumps in there, anything floating around, and then I would hang it. Oh, nope, before I hang it, I am going to open my tubing. Okay, so I've opened my tubing. I'm going to stretch it out, unkink it. Make sure that the port at the bottom doesn't touch the ground or anything. Make sure I get all the kinks out. I'm going to make sure my clamp is all the way closed so no fluid comes out. I'm going to pop open the top of my solution. I'm going to open the cap off my spike and take my spike and twist and turn it into my solution. Make sure it's nice and down in there and tight. And then I'm ready to hang my bag. Okay, once I hang my bag, I'm holding my line so it doesn't fall. I am putting a label on there with the patient's name, A.B. Doman, the date, the time, and my initials. Okay. Then I am going to squeeze and put some of the IV solution in the chamber to fill about halfway. So I do that by gently squeezing it. Okay. Now I'm gonna prime the tubing to make sure that I have all the air bubbles out, because I don't want that. So I'm gonna unclamp it, lean over my garbage, and just open it up. Make sure it's not clamped there. And here it comes. Okay, so once I get all the fluid out, I am ready to connect it to the patient. I previously checked the patient's IV before, so I'm gonna get one of my alcohol pads out, clean the port of that, throw that in the garbage, take another one out, clean the port here. I'm gonna connect them. Okay, one's connected to the patient. Now that it's connected to the patient, I am gonna measure out my drip factor per minute. Again, that's gonna be 31 drips a minute. Make sure that my clamp is closed. Okay. Okay. 6, 7, 8. Alright, it's going a little fast, so I gotta slow it down a little bit. And start over, counting. Okay, it still seems a little bit fast, so I'm gonna restart it again, slow it down a little. And start again. Okay, so I have my 31 drops per minute. At this point, I'm just going to, since it's connected to the patient, just gonna leave it there. I'm gonna make sure the bed's in lowest position, make sure the patient has a call bell. I'm going to tell the patient that I'll be in a half hour to check and everything, their IV, see how they're doing, ask if there's anything else I can get them, hand hygiene, and say goodbye for now. Thank you.